everyone, and welcome back to Medical Minute. This is our podcast, and it's 25th. Woohoo!
Yeah,
This is our 20. This is a
so
milestone
exciting.
for us. Our 25th edition here. Last week we were joined by Josh Robinson, who is here with us again today.
We didn't keep him for a
no,
whole week.
We did not.
promise.
Yeah.
We did not trap him, put him in a box somewhere, and just held him down. But we were really diving into Hodgkin's disease, and of course, Josh was diagnosed at a very young age, in his early 30s, I would say,
Yes.
right, Josh? And so we are continuing the conversation now. Steve isn't here again. He's taking a little bit of time off, but he'll be
Yeah.
back next week, right, Jill?
He will be back next week.
What did you do? Anything?
I
You
didn't.
did-
No.
Okay, we miss you, Steve, but you'll be back next week. So let's dive deeper into Hodgkin's disease and give us a little recap for those that might have missed last week's
Yep.
episode.
Just a little bit of a little overview. So we talked about the difference last week between Hodgkin's lymphoma and non-Hodgkin's lymphoma, and how Hodgkin's lymphoma has a very specific cell that is standardly associated with it. How Hodgkin's tends to be the upper body when you're diagnosed versus non-Hodgkin's can be diffuse and throughout the entire body. We also came off of a lot of discussion in the month of March about different cancer awarenesses and screenings and things that you can do for those cancers. So, one of the questions would be, especially for young people, is there anything that you can do for screening for lymphoma, especially Hodgkin's lymphoma that hits those 20 to 40 range? And the answer is no. There is not a test that you can do that is specifically looking for it. Usually what happens is the patients present with symptoms. Most common are fevers, night sweat, weight loss. They've got a lump or a bump that has shown up that was new. And after, usually a little bit of time, you kind of give it what you feel is a respectable amount of time.
Because Josh, that was your case, right? You actually felt
Yeah, just
something?
the lump though. I had no other symptoms. I caught it in stage 1A, which is pretty rare for that. So got pretty lucky with it. All my blood work, like you were saying, perfectly fine.
Yep.
So we mentioned there's no real screening test for it, but there are symptoms. And if someone is out there and thinking, the Hodgkin's disease deals with the lymphatic system. So you're talking about lymph nodes. So if you're at home and you're feeling yourself and you feel, a lymph node, sometimes we get them when we get a cold or whatever, you can feel those little nodes. So what should we be looking for?
So
Jill?
I definitely don't want to make hypochondriacs out of all of our viewers because, obviously the discussion of cancer and a diagnosis can be very scary. And then, we've been talking about awareness and making sure that you don't have anything and be aware of your body. But at the end of the day, if you have an enlarged lymph node, you can get those. You can get those with a sore throat. If you have a respiratory infection, you can notice them in your neck. Some people coming off of the COVID vaccine had some enlarged lymph nodes underneath the arm that they had the vaccine in. If you have an injury, you can have an increase in the size of your lymph nodes. So if you have a otherwise healthy individual that comes into a primary care office and says, hey, I've got this lymph node, standardly the primary care doc is going to say, well, let's treat for what commonly could cause an enlarged lymph node, and they're not automatically going to jump to, we think this is the big C.
Because that wasn't the case with you, Josh. You were just complaining of some soreness or what have you, right? And it ended up being a diagnosis of cancer.
Yeah, it wasn't even sore. I felt a lump when I was doing bicep curls, and that was it. And again, when playing hockey and whatnot, I felt like I just had a little bit less pep in my step, but I couldn't really explain it.
Did you have the night sweats and some of the other?
Nothing.
Because what are some of the other symptoms that
Fevers, night sweats, and weight loss.
weight loss?
They call those B symptoms.
Right.
So you were talking about how you had stage 1A.
Right.
Stage 1B would have meant that he had fevers, weight loss, or night sweats along with it.
And I was going to ask about the staging and how that comes into it, because I know
Staging with lymphoma is just like real estate. It's all about location.
All about location. So
Yes.
that his staging was at the very minimal.
So he had one lymph node area that was involved. And so then if you have more than one lymph node area involved, then you're a stage 2. If you have a area that is above or below the diaphragm and you have one above and one below, then you would be a stage 3. And then if you have any widespread distant disease, so let's say, like Josh was saying, he had it under his arm, and then you had it in, a organ or in the bone marrow, or there are just some interesting places that lymphoma can present itself.
And
So
Would there be a chest mass too in there? Because I remember getting scanned for something like that.
because Hodgkin's lymphoma is most commonly in the upper body. Standardly, you're going to get scans of your neck and your chest. They're still going to do abdomen and pelvis, but they're really looking in, that chest cavity under the arms and in the neck for most of those lymph nodes.
And even though Josh's cancer was at its earliest stage, you still had to go through some very robust treatments. And you were telling us a little bit about that earlier. You had the rounds of chemotherapy, but the way that you had to get into your chemotherapy was not the way that I did. I was had the infusions,
Right.
and I had a port initially, but my port, had to be removed surgically.
Gotcha.
But you didn't have that.
Yeah, so originally the first care that I went to, they said, hey, this is our standard procedure. We're going to install a port. Not too bad of a surgery. We'll get you done. And then as soon as that heals up, we'll start the treatment. Just happened, my wife was Googling out there like young adult cancer programs and found Children's Hospital that they'll take you all the way up to 39 years old. So
Yeah, because you're a young guy, and
Yeah.
like again, we're saying that this is a disease that really kind of affects most often between that 20
and 40.
40, but
Right.
of course at any age, I think
They didn't make you wear the gown with the teddy bears on it, did they?
no, they did not.
you didn't feel like a little infant, right?
Right.
But talk to us about how you did receive your chemo treatments.
Right. Well, what they did was they presented a lot of options to me. It was, hey, yes, you can do a port. It's most likely the most safest way. But also, since you caught this so early, you're young and you have decent veins from just being active, being healthy.
And drinking lots of water.
And I do drink at least probably a gallon a day throughout the day.
Were you doing that prior to your
Yes.
diagnosis?
Yeah, I've been doing that for a
I
number
think
of
that
years.
helps. Yeah.
Steve, if you're out there listening.
Yes, Steve. He's not here.
Yeah.
He's somewhere drinking some water, but
Yes.
that helps definitely.
Right. So they also presented the option of doing a PICC line, which just has a lot of maintenance to it, but you don't have to have a surgery. But
Right.
I opted to go ahead and give the IV treatment a try, which means there's a long catheter, but once you are done, there's nothing to remove. So there were some times where it was pretty painful. You would feel it, going up, and then
Coursing
I would
up your
mostly kind of
veins.
feel it up here, which is on its way to the big arteries, right?
The big blood vessels.
Right,
yep.
the big blood vessels. But I went with it because I didn't want to have to deal with, the aftermath of a port and having it in there, because I still think I would technically have it in right now. And as soon as I was done, I wanted to get back to
Normal.
I wanted to get back to normal and playing sports, and the thought of taking like a puck
Yeah.
to a port was not very appealing to me.
And Jill, you were mentioning that this is a kind of, because this is going into the lymphatic system, it affects your immune system as well. How long does a person or a patient have to be worried about their immunity after they're done with their treatments?
I mean, it takes a little bit of time to get completely back to normal. Obviously, and I'm sure that you saw this, your blood counts, they would take a hit and then they would recover. But even though they had recovered, you still just weren't at full speed.
Yes.
It takes a solid 6 months to a year, sometimes longer, depending on the condition and the treatments that you've had, to allow your immune system to fully heal so that it's, full force.
Right.
So they definitely are very big on making sure that you've had your vaccines and that you're staying away from people that are actively ill, just trying to give your body time to recover.
So Josh,
Yeah.
how has being diagnosed with Hodgkin's impacted your life? If you were to kind of sum it all up.
Oh, if I could sum it all up, I'd say, from a physical standpoint, not really. Again, after treatment, since I did IV, I had some cording that I had to deal with, which was mostly just obnoxious, and it was weird to be,
You're going to have to explain
feeling,
what that is.
Yes. Okay. So for those that don't know, cording is when, if you poke your vein, it's squishy, it bounces down and then bounces back up. Cording, it's kind of like having a cable in your arm. It is just hard. It doesn't move. It can be a little painful and uncomfortable. Usually what helped me was just putting a heating pad on it, and that would give some temporary relief.
I went through that as well, but I had to have physical therapy in order to work through the cording that I had after my surgery. So where are you at this point, Josh? And I know both of us, cancer survivors, we're so blessed and so happy about that. But at this point in your life, where are you? And do you have cancer in your rear view?
No, not at all. What helps with a lot of that is therapy. There were therapy options at Children's, and now that I'm finished with treatment, I've kind of gone out to find different therapy options. There's a lot of good apps and things you can do. I won't do any free ads on here or anything like that, but I've been sticking with that. And that's what helps the most now, is dealing with what I went through. Now, one of the good and bad things about it is there were drugs that you are on in treatment that help with the dizziness and the motion sickness that come with Hodgkin's treatment. A side effect is I don't remember a lot of what I went through, because half the time I was on Ativan and half the time I was on something else. And another side effect of those is a bit of memory loss. So that kind of mixed with the trauma of it all.
A little bit of the chemo
it's all
brain,
pretty, it's all pretty hazy from that time.
Which isn't always a bad thing.
Yeah, it's not too bad. And then now, yes, the therapy helps out a lot.
Yeah.
Jill, are there any new medications, any new trials or studies that deal with Hodgkin's?
So there's a lot going on with all of the lymphomas and Hodgkin's as well. There are, and it's not standardly being used in frontline treatment because with a 95% survival at 5 years, you kind of don't want to break something that's not broken, or you don't want to mess with something that's not broken. And so when you have such a great result out of standard of care and patients are doing so well, they definitely don't mess with that. However, if patients are in that very small percentage that have a relapse or their disease doesn't respond like they think it's supposed to, there are multiple treatment options after that and tons of studies that are being done. Right. There are targeted drugs that look at the CD30 cells, which are part of the lymphocyte. And like that drug actually has a chemotherapy attached to it. And so when it gets to that cell, it injects that cell with the chemotherapy, and then the cell is destroyed. So that's actually already been approved in refractory Hodgkin's, and they're looking at different studies with that. The immunotherapy drugs that we've talked about, in a lot of detail, those drugs are being used in relapse or refractory Hodgkin's disease. Another standard of care forever and ever, if you fail frontline, the first thing that a lot of people will do is they'll be evaluated for a stem cell transplant.
Gotcha.
And then along with that, because stem cell transplant, the big thing that everybody's talking about now is CAR T cell therapy. And we've talked a little bit about that in previous episodes as well. And so that's being studied and also being used in Hodgkin's.
Well, we are hopeful and praying that you won't be looking at any of those kind of studies.
Yeah, much
you're
appreciated.
Doing well, right?
Yeah. I'm doing great. Playing hockey, staying active.
Looking good, and right now,
thank you.
Done with cancers in the rear view.
Done with cancer, yes.
Yeah, well, we're glad you could join us, Josh Robinson.
Of course.
Josh, if there was anything that you could tell somebody that was starting on their Hodgkin's journey, like a pearl of wisdom, what would it be?
It's going to suck. So it's going to suck. That's one of the best things my doctor said. Other people would say, hey, it's not going to be that bad. He goes, no. You're going to feel pretty crummy, but you're going to get through it. And again, you're going to live a long, happy life, and you're not alone.
And
That's
you,
awesome.
and we're so glad you are here to tell everyone that. Thank you for joining us. Thank you all for joining our podcast, our Medical Minute. Please share and subscribe, and we'll see you back here next week. Steve is going to be here, and we're going to find out what he's been up to. So take care. Have a good one.